Now we take a turn towards health matters, and the massive TB screening campaign is a 3-year campaign being undertaken and run by government and USAID to promote the prevention, screening and treatment of TB in South Africa. Now announced during World TB Day by Deputy President Cyril Ramaphosa and Minister of Health Dr. Motsoaledi, the campaign is a demonstration of government's commitment to ensure that TB is eradicated in our country.
Fellow South Africans, more people in South Africa die from tuberculosis than any other disease. On average, 40,000 South Africans die of TB every year. TB is transmitted in the air. This means we can all catch TB. We want every person to screen for TB at least once a year. The signs of TB are coughing for more than 2 weeks or for any other duration if you are HIV positive, having fever for more than 2 weeks, unexplained loss of weight, night sweats, fatigue among children. If you have any of these signs, go to your nearest clinic to be tested for TB. TB is curable and medication is free. Live a healthy lifestyle. Don't ever smoke. Join the massive TB screening campaign. South Africa, we can beat TB.
Some powerful words indeed. Now joining us on the line this morning to shed light on the movement is the Minister of Health himself, Dr. Motsoaledi. Doctor, a very good morning.
Good morning, and good morning to the listeners.
Thank you so much for joining us on quite a momentous occasion. I know you guys have put a huge amount of effort into this. Now, in a South African context where we face serious epidemics like HIV and AIDS, why has government and USAID decided to focus specifically on TB?
You know, that's a very good question. It is true that HIV/AIDS took the world by storm 30 years ago. And a lot of activists and organizations, even up to United Nations level, were formed to try and fight the pandemic. Good so. But when we check, we found that TB has been there at least for more than 200 years. And when we look into statistics, in that 200 years, TB has killed more people than all the other diseases put together, including HIV, AIDS, malaria, yes, bubonic plague that happened in the 18th century, etc. All of them, if you add them together, TB killed more people than them. But it doesn't cause a lot of ripples around the world. I'm sure in the clip you just heard about South Africa, that annually, I mean, just in the last year, 40,000 people died of TB, and actually, 80% of the people who are HIV positive, their cause of death is usually TB. In 80% of the cases, the other 20%, of course, is other causes. So around the whole world, TB is a problem, and we thought we need to start putting it on the map so that we can start dealing with it.
Now we look at possibly the biggest TB screening campaign in the history of the country, which is commendable in itself. But this must be a massive rollout for you and your team. Talk to me about the campaign, how it started, and the fact that we are now urging millions of South Africans to be screened for TB. How is this campaign going to come together?
Yes, in the State of the Nation address, you might realize that the President mentioned the successes we scored against HIV/AIDS, and he said from now onwards, we want to focus on TB. That's exactly what he said, and that's exactly what you are doing. He said that in February, and on the 24th of March, World TB Day, the Deputy President launched this campaign. What we did is we looked at the 3 vulnerable groups in as far as TB is concerned. Number 1 is people in correctional services. Number 2 is people in the mines, especially the gold mines, because of the high level of silica dust. And thirdly, people living in peri-mining communities. We looked at those and then how do we deal with them? But secondly, we said in South Africa, if you look at these 3 vulnerable groups, which districts are the worst affected? And we chose 6 districts that are worst affected. And all of them, if you look at them, they've got a very strong relationship with gold mining, right, for the past century or so. So we looked at those districts and said, let's run the campaign in terms of these 3 vulnerable groups, the correctional services, the mines, and the mining community, and concentrate on the 6 districts. When we finish the 6 districts, we are now choosing the metros. We look at the metros, which metros are more affected than others. And when we finish the metro, we start looking at provinces. Which province has got the highest incidence of TB than others? So this is how we're going to move on and carry the campaign. Now, people, for instance, in correctional services will be easy because they are confined in one space. You can identify them, you can see them. In the mines, we are actually saying the mining houses themselves must conduct this campaign and pay for it. It shouldn't be, the state that must do that because they have employed those people. And all we did was to hire 9 inspectors, which goes to the mines to check if it's happening. And fortunately, the last time we checked, the 9 inspectors reported that at least 90% of the mines are actually doing that. The most difficult part are the peri-mining communities because these are just communities who happen to have their homes around the mines and the old mining dams. Those are very difficult to confine and identify, but we have got mobile units running in those areas trying their best to screen them.
So, Doctor, now spreading that message for you, how does one get screened, and is testing readily available and free for the public out there outside of the sectors that you've spoken about? Maybe that's another important thing which I nearly forgot. Thanks for reminding me. We're also encouraging that people can go to any health facility, be it a clinic or a hospital, and ask to be screened, because screening does not only mean technology. The first screening is actually verbal. You are asked 5 very important questions, and we listen to the answers, the questions to do with the symptoms, which were just read in the clip there. And then from there, you can either do a digital X-ray. We have got digital X-ray, which were bought here with money donated by the Global Fund to fight HIV/AIDS and TB. They bought those digital X-rays for us. We can put you through those. But the last thing, and very importantly, there is a new technology called Gene Expert, which came forth for the first time in 50 years. In other words, one of the problems the whole world was facing about TB is that for 50 years, there was no new technology coming forth to fight TB, either in the form of medication or in the form of diagnosis. Now, in the form of diagnosis, we now have that technology, which is called Gene Expert, which has reduced the diagnosis of TB from 6 weeks, from a week to only 2 hours. I'm saying Wow.
6 weeks because in some countries they go up to 10 weeks before they could diagnose a TB. But now with gene technology, it's only in 2 hours.
Sure.
Now South Africa is the one country in the world which has spread gene expert technology more widely than any other. That means in terms of proportion of population, in terms of the geography, we've got more gene expert machines covering the country than any other. So because of that, we are asking people to go to their nearest health facilities if they really feel if they want to be screened, because we are really encouraging South Africans to be screened, seeing that TB is so widespread in our country.
Dr. Motsoaledi, we'll have to leave it there. Thank you so much for your efforts personally in driving this campaign, but to all of your team, all the best of luck. It is quite an undertaking.
Thank you very much.
And that was the Health Minister, Dr. Motsoaledi, talking about the massive TB screening campaign. Time now for the news.